right.
Hi, I'm Dr. Anantharaman, endocrinologist with Magna Centers for Obesity, Diabetes and Endocrinology, Bangalore. Today, I'd like to talk to you about drugs used to treat diabetes. We all know that diabetes is chronic, and many patients with diabetes will require medication sooner or later. So you may be able to hold off diabetes through diet and exercise for a very long time, but eventually over a period of time with aging, so you will require medication for treatment of diabetes. So let us look at how modern medicine in diabetes are developing. So modern medicines in diabetes, modern medicine is also called evidence-based medicine. So all the medication that we use in the treatment of diabetes have to satisfy two parameters. One is they should be efficacious, that is, they should actually control the blood glucose for sure, and they should also be safe. These are two parameters on which we assess all the medication. So for to this end, what happens is that drugs go through multiple stages of development. The first stage of development is actually animal studies. So before a drug is tested in human beings, they undergo a mandatory set of preclinical trials actually. So we try it in primates, we try it in rat, rodent models of diabetes. Then the drug comes to the clinical testing phase. And in the clinical testing phase, there is something called phase 1, phase 2 and phase 3 trials. Phase 1 trial is when the drug is given to healthy volunteers, not patients with diabetes. This is basically to look at short-term tolerability, whether the drug has any severe allergy, and also to look at the pharmacokinetics of the study. Pharmacokinetics means what the body does to the drug, how the body handles the drug. Does the drug accumulate in the body? Is the drug excreted from the body properly? So these are done on healthy volunteers in a small subset of patients. So then comes the phase 2 trials, where we look at the safety of the drug. So safety of the drug is looked at in about 100 to 150 patients. So the idea is to give the drug, it's not to check whether the blood glucose is actually coming down, but to actually see in a small set of patients whether the drug is safe or not. Then the drug moves to a phase called a phase 3 trial, where we look for the efficacy of the drug. So what do you mean by efficacy? So whenever you say that something is working, we need to statistically prove that it actually works. And the only way to do it is through a randomized control trial. So for example, if you give a particular drug to patients who are already well controlled, so you may find that, just with diet and exercise, they may get controlled much better than others. So observing one group of patients is not enough. We need to compare in the same group, one group of patients who are on the drug and another group of patients who are not on the drug, who are exactly similar in all different ways. So how to achieve this? This is achieved through a process called randomization. This is a very important concept. So unless you have a randomized control trial, you don't know whether really a drug given to treat diabetes actually works in diabetes. So there are so many drugs out there in alternative systems of medicine which have not gone through this rigorous process of testing. So in order to do a randomized control trial, usually the benchmark set by various drug regulators across the world, not only in our country, even in Western countries there are drug regulators. They are the ones who actually have evolved the science of drug regulation. So they have evolved a particular bar for control of blood sugar. So any drug which is used to treat diabetes should reduce HbA1c by at least 0.5%, and usually about 300 patients are tested in a given randomized control trial, which looks at the control of using a particular drug. For example, when drug A has to be compared with drug B, you again do a randomized control trial, and you can say that drug A is as good as drug B, or it is better than drug B using the randomized control trial process. So this offers a very good way for doctors to understand which are the drugs which work better. So unless a drug goes through this process, in modern medicine, we cannot conclude whether one drug is better than the other. And there are a lot of advantages to this process because it avoids two things actually. It avoids giving a drug which does not work, because when you give a drug which does not work, the patient has a lot of hope on the drug. So he has diabetes or she has diabetes, they come to you saying that, we want this sugar blood glucose to be controlled. You give them a drug which does not work or does not work well enough. That's not good. So we should be able to tell the patient, what kind of control they'll get with a particular drug. This is something that we can tell with certainty. Second one is what are the side effects. So contrary to popular perception, side effects are present with all interventions. So even crossing the road is not a safe thing at all times, at every time. So the best time to cross the road may be in the middle of the night, but even in the middle of the night somebody may come in very fast actually. So accidents do happen at a very low rate even for day-to-day things. So it is not possible to have any intervention with zero risk. There is a possibility that a drug that we give to treat diabetes may be safe in maybe 10,000, 20,000 people, but in a rare patient it may cause a side effect. So for this, there is something called the phase 3 trial. In the phase 3 trial, not only they do one study, they do several studies. So what they do is drug regulators and people who develop these drugs, they combine the data from multiple different trials which are used to study the drug, and they look at the safety especially. So does this drug cause certain side effect? We know that drug cause certain side effect, but does this side effect lead to hospitalization? There is something called a severe adverse event, which is measured specifically in the diabetes setting. Okay, so this kind of drug regulation is not available for many alternative and complementary methods of traditional systems of medicine. This is available only in the modern system of medicine. So when you are taking a drug given by a modern medicine practitioner which is backed by evidence, you can be sure that it is effective and it is safe. Thank you.
ನಾವು ಹೆಲ್ದಿಯಾಗಿರ್ಬೇಕು ಅಂದ್ರೆ ನಮಗೆ ಪ್ಯೂರ್ ವಾಟರ್ ಬೇಕು.